Ladies and gentlemen, welcome to another episode of Physios and Friends Around the World. Today, I bring to you a special guest who is also my friend, and we know each other for many, many years. I'm going to introduce her, and then we're going to speak to her about her experience in her career. Today, we have with us Ms. Mariela Zuniga. She's an occupational therapist. And let me read her biography to you, and then we start our interview. So Ms. Mariela Zuniga is an occupational therapy consultant with more than 10 years of management experience in rehabilitation services. Currently, she provides occupational therapy in home-based settings in DC, and also holds licenses in Maryland, Virginia, and New York. She has expertise in home assessment and home modifications and has collaborated with the DC Office of Aging in implementing the Safe at Home program, which provides safety adaptations in and around the homes of qualifying seniors and adults with disabilities. Additionally, she conducts home accessibility and safety evaluations for private clients who opt to thrive in place. She advocates for older adults and consults with startups and tech innovation in aging and longevity space. As a consultant, she also provides and advises management groups, both here and abroad, in strategy, markets, insights, business development, and operational processes. She has served in leadership capacities in various settings, as a QA manager in early intervention program in New York, as a lead OT in schools, outpatient clinics, and as supervisor, then director of rehab services in one of the largest home health care agencies in New York City. Since relocating to the Washington metropolitan area, she led rehab teams in skilled nursing facilities and successfully turned operations to profitability, improved compliance, and drove high levels of client-patient satisfaction. Mariela completed her bachelor's in occupational therapy from the University of the Philippines, Manila. She also holds a master's in business administration from the Instituto de Empresa Business School in Madrid, Spain. Mariela earned an executive certificate in home modification from the University of Southern California and is also a certified aging in place specialist through the designation program of the National Association of Home Builders. She also has completed her certification in dementia practice from the National Council of Certified Dementia Practitioners. Her volunteer work included serving as an ambassador for the Washington, D.C. chapter of Aging 2.0. She also successfully managed for 4 years the mentorship program of MET United States, an international nonprofit organization dedicated to helping women and entrepreneurs through mentorship, education, and technology. Ladies and gentlemen, please welcome Ms. Mariela Zuniga. Hi, Mariela.
Thank you, Imro. It's very nice to be here, and thank you for inviting me to be a part of this project. It's good to see you.
Thank you, Mariela, for being with us and sharing your experiences with us. Now, I know your career has been spanning for decades, and you have been wearing many hats.
Yes,
you've been a consultant in tech, in healthcare, and you have worked as a director of rehab departments. Now, tell me, Mariela, how this journey started, when this journey started, what motivated you to choose this profession in the first place back in the 90s?
Yeah, so it kind of began when in college you use occupational therapy or physical therapy as like a pre-med course. My parents were doctors, and so it was like a path that would default to it. But as it turned out, like OT is a way to be an individual career in itself. You can grow into it if you want to. And some of my cohorts in college have also successfully established their careers in their own niche. It became like, as I go along with the career, I realized that as therapists, we tend to establish a more in-depth relationships with our clients because we spend more time with them compared to like the doctors. Not that I'm criticizing or anything like that, but it's more in-depth because you spend like at least like half an hour or an hour with a patient. So you get to know them more personally, in such a way like how is their life at home, what's going on. They tell you. I mean, as long as you have established a very good rapport, they will tell you stuff. So it's not just the physicality that you're treating, but you're also making a difference in the emotional and a mental well-being of people. Then shortly, I worked for a little bit in the Philippines in a pediatric clinic. But then shortly after that, I went to the US and started as a school-based occupational therapist in Florida. So being in Florida, it was a good way of learning the US system. It's like a benign way of learning how the ins and outs, the taxes and all that, driving. And after 3 years in Florida, I made my way to New York. And lo and behold, New York reminded me so much of Manila because it's a big city. So in retrospect, I started with working with children, and then it gradually moved into working with older adults through when I got to New York, like group homes and then home health. And then after home health, I went into management, operations management for home care in New York. So that dipping my toes in that segment, it also opened up a lot of learning opportunities and education for myself and applying what I've learned in business school and all that. So all in all, it was a very enriching decades of career so far. And then moving here to DC is also management. But there also came a point when, you kind of feel you're always solving or putting out fires, and you kind of feel like you wanted some changes. So I went back to like home care and also now consulting for older adults in segments of like technology, aging in place, the longevity sectors of the environment, of the ecosystem. So that's how it started for me.
All right, right. I mean, you started with pediatrics. We met back in 2007 when both of us were working in the pediatric field. I was a pediatric physical therapist. You were a pediatric occupational therapist. And that's how we met. And we both moved to a very different field. I moved to private practice with older adults, and you moved to home care and consulting with older adults or seniors. Yes. Now, this consulting that you've been doing, it required a lot of certification and experience, because this is something not necessarily we learn at school, because it requires a long experience and practice and knowing their needs, which are very individualized. And how did you come to know all these? Through certifications, or how would you say that, what prepared you for this?
That's a great question, Imral. So when I came here to DC, I was managing a rehab department for a skilled nursing facility. But there's, like after working the 8 to 5, I was searching for something else. I guess it's also was like a professional journey. And I joined a group of Aging 2.0, which is like an ecosystem for technology innovation for the older adults, because there is a big need for that. And also in that space, I met someone who was working with the DC Office of the Aging, and he said, why don't you try and get into that space of aging in place, which is helping older adults thrive in their homes, making sure that they're safe and they prevent falls so that they could optimize their lives at home, because most of the, as we age or as we advance in years, we know that people thrive better at home. So I looked into that. He suggested like contacting people. So when I was a newbie in DC, I was also trying to find my own community, like finding your people. So he connected me with someone, and she was also an OT, very established in the aging in place segment. So she said, why don't you look into getting a certification for aging in place and home modification? And it was something that I was really got interested into, because although I worked in home care and then in nursing homes, people eventually want to return to their homes. So ultimately, you want them to be more independent, safe, and have a very robust life in the golden years. So I got certified in that, and it became like much more easier. What differentiates me from like the home builders and the contractors who also gets certification in aging in place, and like I know some designers, like interior designers, would also get into that, is because I'm an OT and I've worked in those settings like home care, skilled nursing, and outpatient. Then I have a more encompassing background on what to consider as people age in place. Like you take into consideration the progression of the condition, the disease, how, because of the science that's behind it and what you learn in school, you learn like, okay, in 10 years, you may be just working with a rollator, but in 20 years, you have to have like a bigger space in order to manage your wheelchair and whatnot. So I guess like that piece, it makes it more special, because you kind of look at the person as they progress through life, because we've learned that. So that's how it was. And then as I evolved in the space, it was also important for me to understand, because I'm seeing a lot of dementia patients, to get another certification. Just so not just helping the person or the client, but also extending support for the caregivers, because as we know, it's very difficult for caregiver to manage and sustain a long-term care in the home. So yes, with the background in rehab and occupational therapy, with experience in that, it became, you became more strategic in what certifications you're going to get and what niche you want to get into.
Right. I mean, that's a very, enlightening and unique experience that you have. Now, my father has dementia, and my father lives in Bangladesh. And the diagnosis of dementia is becoming more common among the elderly, maybe because they're living longer.
Right.
That could be one factors in Asia, especially in Bangladesh and around Bangladesh, other countries like India and Pakistan. Now, the thing is, as you mentioned earlier, for the caregivers, it becomes very difficult. It became very difficult for my sisters, for my mother to take care of him. So that now he's living in a senior assisted living facility. Now, areas like Philippines, Bangladesh, India, other parts of Asia and Africa, where it is hard for them to gain this certification, where do you think the therapists, physical therapists, occupational therapists, other caregivers would learn the knowledge that you have, would gain some ideas so that they can implement at home or at nursing home or at senior living facilities?
Actually, like with the NCCDP, there is an affiliate organization, which is the International ICCDP, the International Council for Certified Dementia Practitioners. And, like in the web right now, in the internet, there is a treasure trove of possible resources. It may not be in your home country, but you could definitely reach out to other countries which has like a more established structure for helping with caregivers. There is the Alzheimer's Association. You could look into that also, just to get the resources or like materials that you could read into. It might be a good idea also, let's say, for countries to have, because I know like in Asia, there's also the stigma of it. And it's one of the most challenging things is like people don't talk about it as much. So by talking about it, having discussions about it, and saying that it is a condition that needs to be addressed, it takes the stigma away. And also, as people learn more that it is okay to ask for help, especially for caregivers who are, having a lot of challenges caring, it's okay. Then I think people will come to the table and talk about it. And then by itself, I'm hoping by increasing the awareness, you can also forge like relationships and association in those home countries so that they could help each other and support each other, because it is very important. It is tiring. I've seen a lot of households, in fact, the devotion of the family to serve and be there. But there is something called as compassion fatigue. And you need that network, you need that chain of people to also help you and kind of help guide you with what resources are out there. So I would suggest like looking into in the internet, but like to start, there is the International Council of Certified Dementia Practitioners. They do conduct certifications for it. But it is important to talk about it so that people are more aware and you get the buy-in. Yeah.
Right. Well, thank you so much about that, because I know that creating awareness, as you mentioned earlier, that's one of the first thing that we need to do in countries. But of course, not only in US, but outside of US, in third world countries, in countries where people are not even aware of the symptoms. They think that it's just aging and it's just normal, natural for people to start forgetting things and eventually get, severe when it comes to their, losing their memories and forgetting their tasks. In New York, as I am in private practice, and I'm seeing a lot of immigrants who are elderly, and we do see some early signs of dementia. And they tend to forget a whole lot of things. They tend to even forget the history when they tell us about the disease condition, their medications, things like that, their exercises, the things like when was the last time they had physical therapy. And we tend to see these early signs and we notify it to the doctors. And again, as you mentioned, that also the family members have to know, acknowledge, identify the symptoms, and consult the specialist whenever necessary, even in early stages, so that we do not come to a situation where they are at risk of having other, health or physical conditions. Let's say they can have a fall, or they can have other issues by not taking medications, for example. Yes.
Yeah. It is very important. Like I said, talking about it, it kind of like opens the gates for people to come and seek help, because I know, for especially for Asian cultures, we tend to keep everything behind closed doors, but the help is out there, and it is okay to ask for help.
Right. And I think also the children, the adult children, have to tell their elderly parents that what are the issues that they're facing. They have to be open about it, because sometimes even the elderly parents, they think that by telling their children that I have poor balance, or I fell down today in the bathroom, they would think that I'm giving my children more burden because I'm depending on them on my daily needs, and then this is giving them additional burden. But I think they have to be open-minded and talk about their health issues, and also the children have to watch very closely what's going on with their elderly parents. And
Exactly.
there are other things that I see clinically as I treat them for even simple knee arthritis is what I see: depression among
Yes,
elderly,
exactly.
loneliness, yeah, loneliness,
Yeah.
depression, anxiety, sleeplessness. So
Mm-hmm.
I see that when I see the list of medications that they're taking, I see that antidepressives, I see anti-anxiety
Mm-hmm.
medications, sleep medications. So or meclizine or other medications, and it's very sad to see, you know, them going through this situation. And I think, as you mentioned, that us as therapists, we spend more time compared to other
Right.
healthcare professionals, and we have to be compassionate towards them as they come to us, even just for simple knee arthritis or elbow pain or
Exactly.
stiffness in hand, even though it's a orthopedic condition, but again,
Mm-hmm.
provide them with that mental support and
Right.
that they need at
Yeah.
this age.
It's
Um,
it's seeing the person as a whole, not just the condition of the
right,
physicality. So like what you mentioned, you see a lot of depression. It is a very prevalent situation, especially with older adults, the isolation and the loneliness. It's hard for them, especially like let's say they're in their 80s.
mhm,
Most of their friends and cohorts have passed. Who did they reach out to? But it's also one way for family members to check. Like whenever an older adult has to go to the doctor usually has to do like a false assessment, false risk assessment, and
right,
ask if they have fallen in the past 6 to 12 months. Like one thing that they could emphasize is they need to say the truth that they fell,
right,
or they kind of like had to when they trip, or they had to like come from the floor. Sometimes like, no, I just had a lip. I kind of like trip, but I did not fall. But anything like when you define fall, it's like if you lower yourself on the ground, or you kind of like
lose the balance,
lose a balance.
right,
This is an indication, and you want to make sure that the doctor is aware, or the nurse practitioner is aware, because medication, other conditions such as blood pressure might affect that, and you don't want to do you want it to happen again, because as it is, if falls is very costly, not just in this country, but of course around the world. And you want
mhm,
to prevent that, because once a person falls, the decline becomes more rapid after that. So you want to prevent it in happening in the first place.
right.
Yeah,
And Mariella, last month, a month of September, was a fall prevention month in
exactly.
US. Yes, and so I did a couple of lectures, I did trainings in Bengali and in English
Mhm.
about fall prevention and balance improvement. So you see, it's so unbelievable that every 14 seconds an elderly person comes to emergency room in US due to fall.
Right.
This year alone, one out of three adults who are
Hmm.
65 and up will fall,
Exactly.
and one out of two, meaning 50% of people who are 80 and up, will fall this year. So it's that
Mhm.
common. And so one of the reasons of fall is, of course, home cluttering at home, the home environment. And as you mentioned earlier, that's one of the things that you do, the home
Yeah.
modifications.
Hmm.
Aside from medications, we know there are other physical health conditions. Their vision can also affect.
Hmm.
So these are some of the other issues that can cause fall. But again, home environment is a very big factor. And as you mentioned, that
Hmm.
home is an environment that is very important for their mobility, for their
Hmm.
functionality, for their recreation. So uh, again, can you elaborate a little more about the home modification part that you do in your as a practice?
Yeah. So like when I do the home assessment, of course I do the interview, like what diagnosis do you have, like medication. I conduct some of the tests, like the tug test, the Tineri. I check the home itself. Then I see, like, I ask them to show me how they move around the house. And in consideration of their age, their, their TOG score and their genetic, the false assessment test, then you kind of know that if they're a mild risk or a moderate to severe risk for falling. So some of them live in a multi-level home. So, and some of them would have extreme pain, like going up and down the stairs. So one suggestion, I mean, sometimes it's costly, is the stair glider or the stair lift. But sometimes just adding an extra rail on the opposite side and having two hands to propel you, that's helpful. Adding grab bars to like beside the toilet, help you get up, going grab bars in the shower. If, for example, patient had like painful joints and it's harder for them to get in and out of the tub, sometimes we can do like a tub cut. Or if it's like the budget is not a constraint, then some of them would just renovate the bathroom into like a walk-in shower, and because it's much easier than having the tub. And there is the issue of decluttering. It's a very touchy subject, especially for older adults, because they like holding on to memories and the associated emotions with it. So you can only make suggestions, but ultimately it's their decision to declutter. But one of the things that you could mention is like, I know it's important and I know this is a process. You tell them that this is a long process. It would help you for your, for safety, that you try to review beginning now, earlier, and then just, little by little, working through what you really need in the home to help you feel safer. Don't take away the value of the emotions attached to it, because it is a process for them. So just let them know that you're not rushing it, but little by little, you might want to work through certain rooms to make room for a clearer pathway so that they can get in the bathroom safely at night and not fall. So it's not taking away that power that, oh my God, she wants to change all that. No, you just tell them that it is a process and you understand the process, and you want to give them time to think about what is important to keep in the house.
Right, yes. And especially in Asian community, I also suggest that making sure that the bathroom floor is not wet.
Exactly.
And then there's enough lighting in the hallway, in the bathroom, in the kitchen, in the stairway, in the lobby, so that you don't trip and fall. And then making sure that the carpets and rugs and things like that.
Especially bath mats in the bathroom, because I know in Asian countries it gets humid.
Right.
But at the same time, some bath mats would get iffy after a while, so you just clean it. But yes, the lighting and making sure that there's enough ventilation so it dries out.
Right.
Yeah. And make sure that the towel racks, some people say, no, but I hold on to the towel racks. The towel racks are not equipped to hold like heavy. Eventually it would give. So there are options that grab bars could, be replaced with the towel racks, and then they just put the towel there. But yeah, it's important, as you said, like the lighting and making sure that the carpets doesn't get in the way with the equipment that they have.
Right. Mariela, we're almost at the end part of our show. So before, my last question would be about the occupational therapy career. In Asia, still in some of the Asian countries, especially in South Asian countries, still there are more physical therapists compared to occupational therapists and speech therapists. So they tend to come to physical therapy field rather than going to other fields, which may not have much opportunity in those countries, but outside of Asia, the opportunity is endless for occupational therapists. Now, what suggestions do you have for younger people, for the youth, would like to come to occupational therapy field?
OT is very dynamic because it talks about the occupation of the person. It's not just involving the use of hands, but it's the use of the entire being, basically, because in order for you to do your occupation, whether you're a child or let's say start with like a baby, a child, a teenager, an adult, or older adult, you have to use the entirety of your system to be able to do your occupation. So primarily, I want to say, like with either PT, OT, or speech, is a service-oriented career. You want to have to serve. I mean, there's no way of going around. You would like to be service oriented. It is heartfully gratifying, and you have to have patience because it doesn't happen overnight. With OT, you get to work in different settings, and you see the wholeness of a person, because it is important for them to work like just brushing their teeth, combing their hair, being able to dress. One of the significant and memorable experience I had this patient. So he's a big time lawyer in DC, but he had like a spinal issue and also a stroke. So he was in NRH, and then I was discharged at home, and I started working with him at home. So you see how he's moving at home, but at the same time, he had a very busy law career, and he still wants to get involved in that. So you work with what you have at that moment and improve them so he could eat with both hands, because that's important for him, go to the bathroom and make sure he's able to dress and now get ready for Zoom meetings. And lastly, I was able to successfully help him get in and out of the car, and now he's driving. So he wrote me this like really nice letter that it's one of the best things that happened to him is to be able to drive and kind of reclaim a big part of his life, because that's important for him. So OT is a very practical career, because you work with what's important for the person and what's going on in that stage in life. So I would encourage people, the youth, to explore that. It also takes a lot of heart and patience and passion, and to really know your clients and what makes them tick. And it becomes very purposeful in the long run, and heartening. Yeah.
It surely does. And looking at your career that spans for decades, and in so many different areas and fields that you have, and countries too, that you have worked in. Well, Mariela, thank you so much. It was such a wonderful experience talking to you, seeing you.
Likewise, it's such a pleasure to be a part of this. Thanks for the opportunity.
And yes, so I'm sure that our audience would learn a whole lot about the specialty the specialty that you're working on, and I'm sure that there's a big need and demand for that in many parts of the world. And again, thank you. And ladies and gentlemen, again, I thank you for joining us tonight.
Thank you so much.
We hope to see you again next time in another episode of Physios and Friends Around the World. Till then, good night.
Thank you.